an app that can improve the health of patients with type 2 diabetes. Welcome back to Techstination. I'm Fred Fishkin. Joining us from Klinio is Head of Medical Affairs, Dr. Kasparas Aleknavicius. Thank you for joining us.
Hi, Fred. Thank you for having me.
Well, give us the overview of what Klinio is.
Basically, Klinio is a mobile app which is helping diabetes patients to manage their disease and helping in terms of education, patient empowerment, learning about various kinds of foods, various kinds of workouts, goals, what their goals should be. We're giving patients insights, and everything is done to help patient manage his disease.
Some of the differences between what you have in the app and the many other fitness and dieting apps out there. What are the key differences?
We are a huge upgrade when compared to general fitness apps. We try to satisfy different user personas. It means that a person who has recently been diagnosed with diabetes and a person who has diabetes for 10 or 15 years, they're two completely different users. One of them is very stressed about new diagnosis, and another one is already an expert and they have different problems. So we try to solve those problems in a creative way. For example, for users who are who have diabetes for a long period of time and they are very well read, but they still have fundamental problems of not knowing what to eat, and we present the solutions in a funny way. For example, evaluating your food photos and evaluating food photos of others. And at the end of the week, nutritionists or health coaches come in and they facilitate a discussion based on those evaluations. So we try to keep users engaged in a creative manner, not just provide information.
Tell us a little more about the user experience here. Step us through from the beginning, somebody new to the app.
Usually it is constructed in a daily, weekly, and monthly manner of tasks to be done. Those daily tasks are tied to either educational curriculum or clinical medical information coming from ADA or CDC or other official sources. So basically, you can use an app every day. You can use it every third day. You can use it every week. It is designed to be used in various loops. Basically, the experience is complete reading about daily tasks, why are they important, and completing them.
What kinds of tasks? What are you referring to?
This could be, for example, for people who have been recently diagnosed. Those tasks are comprised heavily from the reading part. It is educational curriculum from American Diabetes Association. For pre-diabetics, it is different curriculum for Prevent T2 for CDC. And those daily tasks, for example, first daily tasks are realizing what you have to do, building your plan, how you will do it. For example, how will you increase your physical activity over upcoming 6 months or upcoming year? First tasks could be taking a pledge, realizing that you are ready. So this is kind of psychological readiness for the patient. We could call this activation and initialization. For others, it could be like onboarding experience, like setting up an application. For example, if you're a type 2 diabetic, the first daily tasks are basically about the application. You are setting up how and when you will take your medications, how or when will you eat, will you or won't you be able to do that. So first tasks are about planning. Then it goes about structuring your physical activities. What are you able to do? Are you keen on working out in a gym? Do you want to work out at home? And then we structure workouts for you. Do you want to work out with your own body weight? So first about planning, then about initial steps on meals and workouts. And after that, it is closely tied to daily curriculums. It is more or less quizzes, daily steps to take, daily water to consume, daily glucose measurements to take.
And you have a new study from the Validation Institute.
Yeah.
About
yes.
the effectiveness. Tell us about that.
Yes. So we had initial hypothesis of mobile, of how much a person should use an app to achieve meaningful results. We explored that hypothesis, and we also wanted to explore what are the certain thresholds, or what are the certain actions the user what are certain actions that bring user to that result. So we basically took our users, retrospective data who have been using an app, and we compared the results in between them, in between groups. We chose users who had low engagement but meaningful results, and we chose users who had very high engagement with a lot of app actions, but also with the meaningful results. And we tried to find out what is the rationale behind that. And we found out that you have to use an app between two glycated hemoglobin measurements between 19 days period. Between 90 days period, you have to use an app for at least 19 days. It means every third or fourth day, to achieve the meaningful result, to achieve the reduction in your glycated hemoglobin.
Tell us about how pricing works for the app.
Yes, it is subscription based. We usually offer 3, 6, or 12 months subscription. If we acquire users directly through social media, the prices may vary. For example, it can be $3.99 per month, or, well, it depends on the length of the subscription that you buy. Well, the longer subscriptions are usually they usually have cheaper monthly price. And if you pay monthly subscription, it is usually higher.
And for more information, where can people go?
We do have a webpage at Klinio.com with a K. There's all information about an app on that webpage.
The spelling is KLINIO.com. Dr. Kasparas Aleknavicius, thank you for taking the time with us.
Thank you for having me. It's a pleasure.